A new big worry for hospitals if the new rules in the Affordable Care Act mean sharp cuts in federal reimbursements for Medicare in the new year. Bertha Coombs explains.
What we're going to do today is assist you with going online and setting up your account and applying for the Affordable Care Act.
At Parkland Memorial Hospital, the push is on to get patients insured under Affordable Care Act plans.
When we open up at 7 o'clock, we typically open up with 50 plus people coming in. With 10 employees, that already puts us about a couple of hours behind.
In 2012, Parkland provided $685 million in uncompensated care for its poor and underinsured patients. Yet under ACA, the hospital could still find itself in the red.
About a third of our revenue comes from the special payments. If we don't have those revenues, we can't fund the programs that they support.
Under ACA, federal payments to hospitals will be cut starting in 2014 on the expectation more patients will be insured. But Texas is among 24 states rejecting Medicaid expansion, which will provide free insurance for adults with little or no income who cannot afford to buy coverage.
By not expanding Medicaid, I estimate that is costing Parkland about $30 million a year starting next year.
In doctors' offices, the worry is that patients who buy low-cost ACA plans will face high out-of-pocket costs for things like lab tests.
Once you get their preventive care, if there's an abnormal lab, an abnormal finding, what is the follow-up? Is it going to be covered by that insurance company?
Another worry, the most affordable plans have narrow networks, which could exclude doctors patients already see at low-income clinics like this one.
Well, if patients are drawn to plans that we're not in, then what we're doing is we're pursuing those plans ourselves. So we are trying to get enrolled into those networks so that we'll be able to take care of the patients. This is a unique moment where we haven't had to think that way before.
A Commonwealth Fund study estimates that by 2022, taxpayers and providers in states that reject Medicaid expansion will lose out on billions in federal funding. It will cost Texas $9.2 billion that year, while Florida, which also has some of the highest rates of uninsured patients, would see a net loss of $5 billion.
Hospitals in states with Medicaid expansion have yet another advantage over facilities like Parkland and others in states that don't expand. If a patient shows up and is uninsured but otherwise eligible, they can sign them up for temporary Medicaid expansion coverage and get reimbursed.
It would be enormously better if we were part of Medicaid expansion. It makes perfect sense from almost any way you look at it.
Providers expect those states will expand eventually. Until then, they'll try to enroll as many patients as they can. Bertha Coombs, Nightly Business Report, Dallas.